My mum, she made the decision to move to an assisted living facility, which is really independent living. She was there for about a month, and then she had a little fall. And we ended up in an emergency in one of the local hospitals, and she was still very, very with it. So I was quite comfortable that she was comfortable, that there would be some x-rays taken. We would find out whether or not she had broken anything, and if not, then she could return home.
We know that 1 in 3 of every older person admitted to an acute care hospital will be discharged at a higher level of disability than before they were ill. And half of those people never recover. And I really think that if we change the system, at least 50% of that disability is preventable.
After a while, number of hours, when they continued to ask her the same questions and have the same conversations, she turned to me once and she said, "Don't you think they've got it right yet?" Because they were asking the same things over and over again.
Learning to practice collaboratively, involving that patient and their families as partners, minimizes all of the information collecting that we have to do because it's all there within the team.
During the many hours that Mum was in emergency, she wasn't able to have anything to eat or drink by mouth.
Why doesn't my mother have a tray in front of her at mealtime, even when they're in the emergency department? And they're just natural. If you were at home, that's what you'd be doing, is getting up and getting back to doing your normal activities. We know that that individual is going to lose up to 5% of their functional muscle strength every day they're in bed. And that getting them up wouldn't seem to be an urgency to the medical team. But if you're a family member in there seeing that happen, you're going to be saying, why isn't my mother getting out of bed and up and walking?
They wanted to give her something for pain, just in case she had pain, although she was saying she didn't have any pain. And so they had her take Tylenol 2s, and she never took Tylenol. She didn't like taking Tylenol. She said to the nurse, "I don't want to take those aren't my medications." And the nurse coaxed her into taking them, and it was in front of the doctor, so she said, "All right, I'll take them," made her very ill.
We're going through looking at whether or not the medication list that we get when somebody comes into hospital is an accurate reflection of what they're actually taking. So to make sure that the medications that are being given in hospital match with what the person is taking at home.
Don't think that you don't know something that's very valuable for them to know, because they have so much expertise, and if you're not from that environment, you might think, oh well, they know better than I know. But really, we do know our own bodies, and we know what our body can take and what our body can't, and our loved ones often know that, as my mum did. And we need to be able to speak for our loved one when they're in a situation where they can't speak for themselves, and we need to be heard. Things with Mum, it became evident that she was not as responding as well as she should have to the care and the medications that she was receiving on about day 3. She was floating kind of in and out of reality to a certain extent, and talking about people that weren't really there, to people that weren't really there, and then she'd come back and she'd be herself.
Delirium, potentially not being recognized as an acute problem, not Alzheimer's disease. It's a treatable acute problem. And when I look at what is our goal of care, it's to get the patient back to the way they were before they got sick.
It's not the care that was given, which I saw as expert and compassionate and focused. It wasn't that at all. It was that we have a process that maybe didn't quite match the patient here.
It's not a matter of the health professionals know best, the family knows best. It's a partnership around saying, I know what's best for my mother in the context of what I know she was like before she got ill. And we know best how to get through this medical issue, this acute illness that has come up. How do we put that partnership together to get different outcomes?
Well, my mom will never be forgotten, actually, because she has her children and her grandchildren and others that will keep her memory alive. And she brought lots of joy in her older years to many, many people with her smile and her sense of humor. I miss her very much. I miss her more than I ever thought I would.